Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is November 17th, 2025. This video is on a JAMA article titled Efficacy and Safety of Oral PCSK9 Inhibitor and Enlicitide in Adults with Heterozygous Familial Hypercholesterolemia, a randomized clinical trial. There was an accompanying editorial titled Expanding the Arsenal of Lipid-Lowering Therapies. Heterozygous familial hypercholesterolemia affects 1 in 250 individuals with elevated LDL cholesterol and increased risk of atherosclerotic cardiovascular disease. Enlicitide decanoate is a novel oral macrocyclic peptide PCSK9 inhibitor preventing LDL receptor degradation. This was a phase 3 double-blind randomized trial, 2:1 placebo-controlled trial at 59 sites in 17 countries. Adults above the age of 18 with heterozygous familial hypercholesterolemia, LDL cholesterol greater than 55 with atherosclerotic cardiovascular disease, or greater than 70 milligrams per deciliter with no atherosclerotic cardiovascular disease. All were on statins or non-statins. Enlicitide 20 milligrams daily, 202 individuals were enrolled versus placebo, 101 individuals for 52 weeks. Follow-up and statistics, 4 to 52 weeks, primary endpoint week 24. Sample size 303 participants, greater than 99% power to detect 50% LDL cholesterol difference. Statistics used include ANCOVA, Wilcox, and multiple imputation methods. What did they find? The primary endpoint at 24 weeks, there was an LDL cholesterol reduction of 58.2% in the Enlicitide group versus an increase of 2.6% in the placebo group, a difference of 59.4%, p-value 0.001, absolute LDL cholesterol 69.5 milligram per deciliter reduction versus 0.3 milligrams per deciliter in the placebo group. Secondary endpoints at the end of 1 year 52 weeks, LDL cholesterol less than 55.3 in the treated group versus an increase of 8.7% in the placebo group, a difference of 61.5%. Non-HDL cholesterol was also ApoB and Lp were also reduced, p-value 0.001 for all three. Lp was reduced by 24.7% versus 1.6% in the placebo group. ApoB was reduced by 48.2% versus 1.8% in the placebo group. And non-HDL cholesterol was reduced by 52.3% versus an increase of 2.1% in the placebo group. Safety, adverse events, 77.7% in the treated group versus 76.2% in the placebo group. Serious adverse events, 4.5% in the treated group versus 4% in the placebo group. There was one unrelated death. Common adverse events, nasopharyngitis, headache, and nausea. Key takeaway, oral PCSK9 inhibitor achieved 60% LDL cholesterol reduction on par with the injectables, excellent tolerability, adherence was greater than 97%, bridges the treatment gap for heterozygous familial hypercholesterolemia. The accompanying editorial says statins remain the cornerstone of lipid-lowering therapy, but adherence and tolerance issues persist. Many patients with heterozygous familial hypercholesterolemia fail to reach LDL cholesterol goals of less than 70 milligrams per deciliter, even on high-intensity statins. Oral options like ezetimibe B and bempedoic acid reduce LDL cholesterol by only 20%, highlighting the need for potent oral agents. The advances in PCSK9 inhibition include injectable PCSK9 inhibitors, alirocumab and evolocumab, and inclisiran achieve 50 to 60% LDL cholesterol reduction but require injections. Enlicitide decanoate and oral macrocyclic PCSK9 inhibitor achieves bioavailability via sodium caprate enhanced absorption and fasting dosing. Key findings from this CORALreef trial published in JAMA: Enlicitide reduced LDL cholesterol by 59.4% versus placebo, with 67 mg per deciliter absolute reduction, effect sustained to 52 weeks. ApoB reduction by 49.1%, Lp(a) by 27.5% reduction, safety similar to placebo. Key editorial takeaway: first oral PCSK9 inhibitor matching statin potency, poised to transform lipid management, expands patient-centered flexibility and adherence. Competition among potent agents may reduce cost and increase access. Clinical pearls: oral PCSK9 inhibitor removes injection barriers in lipid management. Enlicitide's mechanism parallels the monoclonal antibodies but with easier dosing. Significant ApoB and Lp(a) reduction imply broader atherosclerotic cardiovascular disease benefit. Safety profile mirrors placebo. Awaiting cardiovascular outcomes from the CORALreef Outcomes trial. These are some of the eponyms related to this area of work. Hit pause and read at your leisure. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.